For this or?
Yeah, I'd like to welcome everyone to special call meeting, March 23rd, 2023. And this is for the purpose, special call meeting to discuss an amendment to the ambulance service agreement with Norton King's Daughters Health. So who wants to go first?
Go for it.
Okay, Ray, you have the floor.
Pardon?
You have the floor.
Okay.
You got it.
I was called, spoke to Carol Dozier and, she, was concerned about the rising cost of ambulance, expenses for the county. We did not get, notification, early enough for the 2023 budget. All that needed to be in by last July and August. So we did not receive it until about October, 3 weeks ago.
Well, we got the first request in October.
Right.
October
On the 20, October 28th, yeah.
22nd.
But that was well after our budget had already been approved for 2023. So she had requested $500,000 for 2023, 500,000 for 2024, and 500,000 for 2025. I told her because of the lateness of the request, the budget had already been set for 2023, and that we would do what we could to keep it operational. But I said it would be a joint situation with the commissioners and the council to discuss it. And therefore, that's why we're here tonight. So I'll turn it over to somebody else unless you have a question for me.
Well, I was giving this some thought, and a contract that size, we should put it up for bids, shouldn't we? Request for proposal.
Supposed to be anything over 50,000, isn't it?
Well, for services, it's not always quite,
Well,
professional service, but you're right. I think.
Something of that magnitude.
I would do that for 2024. It's kind of hard to switch horses in the middle of the year right now without having enough time to vet everybody and figure out what's the best option.
And how is that looked upon as far as, and obviously I can't say a lot about this. Opening it up for bids when obviously what the service costs is double what they are asking us to help subsidize. So, and granted, another agency may certainly have a different number, but how does that work as far as the necessity of bids and proposals when obviously the service has been provided free to the county for a very long time? And now the past 2 calendar years, we have made a contribution, but still at a grand loss to the organization providing the service. So there's still a necessity for
The free providing of the service was on their account, not
Correct.
on ours.
Correct.
So, Troy was the guy that kind of clued us in on that, because he said that, they had paid for it, and then hospital decided they were gonna do it for free, so, but, so I don't know that we can use that to, I wouldn't use that as part of the discussion, because that was their choice, right? Wasn't the county's choice. They decided they could do it for free. For years. To say it like that, like we're indebted for that, we are, but it wasn't like we asked them to do it and they,
Yeah,
so.
for a very long time.
That was a certain individual with KDH's choice that, made that decision.
as far as moving forward, I'd say, you know, a request for proposal, you know, we can outline what we require in it, and that way, if people put in bids, we're comparing apples to apples instead of, you know, somebody says they can come and do it for half price and we're getting 25% of the service. That's, you know, we're wasting money there and endangering people, so.
I do think, and obviously I've never been in a position to have that responsibility for requests for proposals, such a project. I'm not comparing this to a proposal for, you know, a paving project, you know, when two companies may have different bids, but they also might bring in different different product. But obviously there is definitely, when if this indeed goes that direction and other agencies are allowed to quote bid or make a proposal, there's a lot that needs to be considered. And for example, there's a couple neighboring counties that only have what's called basic EMT services. They do not employ paramedics. They do not employ advanced needs. And there's big chances somebody in this building right now whose life has been saved by advanced EMT care that this county has been able to provide. So just the volume of, you know, they may say, well, we can provide it. I just want to make sure there's a lot of detail and a lot of questions asked when we consider over 8,000 ambulance runs in this county in a year alone, the widespread nature of this county, making sure that equipment and adequate and very well-trained staff. I don't want that to fall at the hands of a taxpayer when they call 911 and expect and need medical care or inadequate medical care to arrive at their door.
In my discussion with Carol, I did, as far as for this year on 2023, her initial request for 500,000. I did say that because of the difficulty of this year, it coming in so late, that we might be able to come up with 250,000. But again, that I'm just one voice. Commissioners would have ultimate say. 6 other council members would have to buy in on that. So she did say that she, you know, they would accept 250,000 for this year, 500,000 for next year, and 500,000 if we signed a 3-year contract. The 3-year contract would help protect us in one aspect, because then we would be locked in for those 3 years. The problem that I see is the county is burdened with the entire cost of it. So I think we might have to think about, I hate to see any increases in taxing the taxpayers. I could see maybe an local agreement with the other entities, that's municipalities that's in our community. City of Madison, Town of Hanover, Berksburg, I believe DuPont's in that. Is that it?
Yeah.
So those other entities could help maybe share some of that cost rather than the county have to burden the entire expense, since it has gone up so dramatically compared to what we're only scheduled to pay 100,000 this year. So
I'm in huge support of that. That was one of the first questions that I asked. Obviously there's probably a call coming in right now from dispatch and an ambulance going out to DuPont or to Hanover. And I tried to do a little research for other counties where so many counties are fully paying for EMS services, you know, like we have not had to historically for quite some time. And I tried to do a little research to kind of find out if other governmental entities are contributing. You know, look at our animal shelter on a much smaller scale, but see this, it's a big grand expense for this county, but there is a little shared buy-in and cost, because obviously the town, and particularly in City Madison, obviously a bigger chunk, are helping to contribute because they know those doors need to stay open and they know that we need a paid animal control officer and nobody wants to lose that service. You know, this obviously doesn't even compare. This is EMS services for human beings and this is big time. And I would love to see some buy-in financially from other municipalities.
One other thing, I'm not questioning the hospital's accounting or their numbers. But I would be interested in seeing, if there was reimbursement for part of that 1.2 million, from either patients or Medicare or Medicaid. Hopefully they didn't have to bear that entire 1.2 million. So that would be another question that I would be curious to find out, you know, the 1.2. Was that the total cost? Was there any restitution from other agencies? And was any of it, could any of it have been negotiated down? Would be my question, because I know that, you know, having gone through a operation like I did, the hospital bill was astronomical, and they'd come and tell me how much it was going to be. And then when the insurance come in and did the numbers, did their magic, the number was very significantly less. So that would be my, again, I'm not questioning anybody's integrity or their accounting, but I would be interested to know if there was any restitution. I think that would be a fair question.
I had one other idea, and this may be for when the entities decide what the county is going to contribute, then the council has the leverage of finding out where we're gonna find money from.
Yeah.
But I've given a lot of thought, tried to start a little initial research. You know, if we are at a basketball game today, there's an ambulance there, and the school doesn't pay a penny for that. They just have services there because it's the right thing to do and it's needed, you know, when large volume of people. So there's a fan in the stands that goes down or a significant injury on the court. Same thing with when you and I are walking around on Drive on Regatta or Chautauqua, you know, there's coverage there. And I want to verify this of no cost then to those agencies. When I think about, like, I got to try to do a little more research and thought about, for example, the significant increase that we've seen in innkeepers tax. And, you know, amazing, you know, make you smile tourism dollars that, you know, this county has really worked hard. Kudos to all Visit Madison and tourism activities to the county that we know take a lot of pride in this town and this county on what we offer for visitors. And so many of those festivals that certainly locals attend, but those ambulance runs in many cases are out of town guests. These tourism events need EMS services, and volume of calls over those events and weekends are big time. I only say that because as we're trying to get creative and thinking how might pay for this service, or if fortunately this were ever to fall completely on the county's full dollar, could we get buy-in from other governmental entities? You know, obviously a event like Chautauqua, their goals certainly, they want to make money and be able to cover costs to offer an amazing event for this community. They're certainly not, you know, oh, we profited $50,000 this year, but, you know, are there other comparable communities that charge maybe festivals, just like Regatta might have insurance costs to be able to provide Regatta? You know, do they have then a line item and are asked to pay then a little bit for support? And I know you might be thinking, well, it's not ours. We're not providing a service right now. Northern King's Daughters Help is providing a service, so they could charge Chautauqua what they want. I guess my point is they have not historically, you know, every time we see an ambulance or an EMS bike team coverage in an event.
I think they are now. And the only reason why I know this is because at the fair, there was a scramble trying to get support for the grandstand events. And
There wasn't anybody else.
there was no one there
No.
because they said that we had to pay a certain amount. And we had to call in advance for fare.
Per evening.
And con events definitely, I mean, as far as scheduled, but yeah, so
But
far.
they had never
I have
done
not-
that before.
Yeah, and I have not.
So
Not
it even triggered me
gotten that
to
yet.
call
our
Patrick.
festival.
He was assistant AD at that point, and talked to him about that, and he thought that the school even had a budget that they supplemented somehow.
I do not believe so. Now, there is a line item, the schools are paying a small portion for athletic training services. It doesn't begin to cover, it covers some of their hope is it covers some of the like tape and basic supplies, but it does not begin to cover the cost of athletic training, but
But I know
I
at the
was told-
fair, it was a major,
I had one of the fair board members. call
fair
me and
board
say,
members were
"Hey,
very upset.
There's no
and
ambulance
Judy
service
Smith
out
for
here. What do
one.
we do? And it was I guess I want to say highly active event.
Yes,
A lot could have happened and to have nobody there at all.
and they're typically there every night,
and they've
all the
never
time.
had to, yeah,
Never had this.
never
before.
had to have that issue before until
We
last
have to ask about that, but I'm also obviously that's a county event as well. I mean, granted, the grandstand event certainly could have been an outside revenue producing
Right.
event that was paying for underutilizing the grandstands,
Right.
this entertainment and the fair, but the rodeo or, yeah, smash cars or whatever that may have been. I am curious, I'm trying to start to look into other special events that are blessing to this county, and if whoever is providing EMS services, if they're continuing to be expected to do that completely free. Again, I was even thinking about how blessed we've been with addition of innkeeper's tax and thinking, obviously, you hope those dollars then go back to support more tourism efforts, obviously, but yeah, part of that's providing safe events, we think about police coverage. I know, for example, Chautauqua, they have to pay for security coverage. They get extra off-duty officers that, that's a line item they have to pay for because they know they need security coverage. But, are these events maybe not having to pay for EMS coverage where they might be able to contribute a little bit. That's just a thought that I had.
Well,
I mean, I think in the police coverage, that guy is not doing it. I mean, it's not his normal job. He's getting paid to do his job and then they pay him to do that. For the EMS service, I mean, they're paying people to be 24 hours, right? I mean, they have coverage for 24 hours. So either they're sitting downtown or they're sitting at a festival.
Usually additional staff are on, if there's an additional event, more staff are called in. So instead of maybe having 2 paramedics, a basic and an advanced EMT to cover this shift, now they've got 2 additional staff, for
So
example.
for basketball games, they bring in extra people.
Yes.
So they have to stay there the whole time if a call comes in.
That I don't know. I mean, sometimes, because that could depend on if
Yeah,
there's a horrific fire and an accident. and
I
they have to
understand
yeah,
that you can throw the big one out there, but I mean, if it's a small one, I mean, I'm just wondering if they pay for them, are they gonna stay there the whole time?
Right.
yeah,
I mean,
I can speak on the wrestling because I was involved in that. I know that, when they have big tournaments at the high school, they may stop in once or maybe twice today, but they're not there all day.
may not be the
So, they only pop in, see if everything's going okay. You got our number, give us a call, call 911. You need us. So I know they're not stationed there all day. So. But they do cover,
I mean, they cover everything.
right,
Well,
right. We'll probably cover several things during the course of a Saturday morning and afternoon.
I definitely think we need to ask the other entities in the county, like we've said, if they could help out.
Well, the ambulance service, I mean, they're above reproach as far as I'm concerned, because I know most of them. And when I needed them a couple of years ago, when I had to call for Janine, I mean, they're spot on. That's not the issue we're talking about. I just don't think it's fair that the county ought to have to put this whole bill for all this.
I agree.
Maybe do it by a percentage of the county as opposed to the city, Hanover. But, as far as the smaller towns, like Brooksburg, I think they get $900 from some of our interlocals. Same way with DuPont. But I would like to see the runs as opposed
Break
to,
them out where they're,
well, like this came from KDH. Just read it. In 2022, there was 717 or 7,117 encounters, services and encounters. And it says, these numbers include each time a squad is dispatched, including standby community events such as regatta and other festivals. I guess that would mean like the fair or Chautauqua, anyway, other festival, sporting events, public service education events, helping to service local nursing homes, 911 calls, response to accidents regardless of injuries, to transport and transfer to other facilities, such as mental health or patients needing a higher level of care due to serious illness or injuries. And then it says, not all of these services are billable. Well, I'd like to know what any of them aren't billable. I
That would be
mean,
my
nursing
question.
home, most people's in there is on the insurance or, you know, Medicare, Medicaid, and, you know,
I think the low, you know, Medicaid, it's like, you get 3 cents on the dollar or something.
well, they accept it though, right?
Yes, because it's the right
Most
thing
of
to
the
do, and they're
time.
not gonna turn a patient away at the hospital. I'm simply saying there's definitely a huge difference with insurance reimbursement,
Yeah.
specifically excluding Medicaid and obviously for
Right.
the government. I don't know if we classify HIP and others in the same way, but a big difference. It's nearly non-existent, as far as Medicaid reimbursement.
I don't really see where the county's responsible for transports. You know, once they're in their care, their patient, why should, you know, they, you know, we be on the hook for getting to Louisville?
So if it's a county that has EMS services not provided by a profit, not-for-profit hospital, but provided solely financially by and services provided by the county at full expense, you're saying if a patient then needs to go from a nursing home to another nursing facility to in-home care to a hospital, I mean, you're saying the county you wouldn't provide that transport service?
No, I mean, we would bill it to the insurance.
Right. And I think that is being done. I think obviously it's just unfortunately that, yeah, there's a whole lot more dollars coming out than are coming in. I think that's the,
Yeah, they, you know, they might bill an ambulance service at $1,500 and, you know, the insurance may pay 6, 7.
It's not only that, there's some people abuse the ambulance system too, you know,
yeah, we've had some
Uninsured.
discussions about that.
you know, call an ambulance if they're got a runny nose.
We've had, I've been told just of some, obviously no information is certainly ever released, but we're talking, somebody who, is large in stature, took a fall on the floor, can't get up, so they call 911. And there's paid staff and, with an ambulance that have to go and, oh, all I needed was help up, I can't get myself up, so they're. And that's one example of many.
And
Ray
lots of
had a
times-
real
lots
good
of
one,
times
too.
Family could have been there to help get them up. So I guess my question is, do we need to, or do we have the authority to vote for 2023 on the, I guess, recommendation to go ahead and, so we do not lose the service, because legally we can't lose the service, is my understanding.
Yeah, I can, as far as the council goes, I can make a motion to, come up with the 250,000 and for 2023.
I mean, I think, well, when we're doing the finances for the jail and the public safety tax, there was supposed to be money accruing in that account over time. I mean, assuming that things went smoothly, and I think we haven't needed to go there at all. other than making the payments we knew we were gonna make, but still it was gonna grow, so. I mean, I think there's a opportunity, because this is public safety, that, that's not gonna affect the rainy day fund, it's not gonna have to come out of,
You know, if we can avoid using those other funds, we'll be far better off right now.
and, you know, I mean, when Andrew set it up, I mean, that was the purpose, to kind of give us some flexibility should we need it. So, I think that would be the first place, and it should, I mean, we.
Right.
You know,
So the question is, as we were getting ready to adjust the CUME rate funds, or the CUME fund rates, is that something that we should increase the public safety to fund both?
well, I mean, I think based on what I remember from the growth of that line item, I don't think you have to. I mean,
Right, well, I just know that originally they were thinking that some of the jail staff could even maybe move to that at some point.
well,
With the
there was another amount set aside for more utilities and more people, which is separate from the other, this line item, so. Or maybe that didn't happen, but I can go back and,
I think it.
yeah, so.
Okay.
I mean, I think that's what, we ought to look there first. If we need to raise the public safety tax in addition, okay. But I mean, the way Andrew had it set up, he was just making sure that if something happened, we were ready for it. We weren't gonna have to
Right.
start pulling from general and other places to pay for the jail.
Right.
And I think, like I said, we're far enough along into it and kept control of the cost and things that,
We have to advertise that first anyway, wouldn't we?
Yes, because we would have to appropriate, and I would have to, it would be in the May meeting. We have 100,000 right now in lit. But then the 150, if we took that from.
Well, we don't actually have to pay until what, July? And then request them.
I thought we put 150 towards it,
The 150 wasn't requested until the budget,
too late.
mhm.
Yeah, already, yeah.
Yeah, I had to go back
I mean, I think we tell them we've got 100 now with the other 150 coming later, that
Yeah.
they wouldn't,
So,
they would say, oh, no, we don't want any of them.
so,
They'd hope we forgot and gave them 250 and.
If you did take now or whatever, next year and the year after out of the safety tax, that's a fund, that's a line item that's gonna have revenue coming in, so you won't have to worry about it.
right.
Where do we get it this year?
So Heather, can I call for a motion to approve the 250,000 for 2023 at this time? We do have a quorum, the council does
We
here.
have to advertise it first.
We have to advertise it for the actual
Okay.
additional, but you guys could go ahead and vote and say that you're in favor of
Right.
agreeing to that contract.
That's what I thought. So I would call for a motion to make that recommendation. Unless there's other discussion about it.
I'll make that motion.
I have a motion, take a second. I have a second. Any other discussion? If not, all those in favor, signify by saying aye.
Aye.
And those opposed, like sign.
Be noted as an extension, yes.
So motion carries. 4-1 abstain, is that correct? Okay. So I think we're good for now.
I think, like you said, a 3-year contract allows us to plan. I mean, we'd asked them to meet in July, but they couldn't do it, so I'm like, okay, well. They surely know our budget cycle.
So after the 3 year, would it be too much for us to request them to present their contract in August?
Well, so.
Like August of 25,
Yeah,
so that
yeah,
we
okay.
can have the 26 budget proper?
Yeah, oh, yeah. Well, I mean, I think sometime before,
Budget hearing start.
right, so I mean,
So July
sometime in the spring
31st.
of 20,
By July 31st.
Right,
No,
just,
sure, sometime in that first part of the year of
25,
or
426.
26, yeah. If they say, well, yeah, we don't know until, well, if they say August, like, well, okay, then that's not going until the next year, but,
The county government.
yeah. Really.
In the meantime,
I guess it would be safe to say that we'll do
governments.
the investigatory actions before the 24 and the 25, so that we can discuss that at a later date, so.
Well, I mean, I think if we're okay with what we've set up, I mean, we can look around, but I think Heather's right, it's not gonna be 500,000 a year, it's gonna be 4 or 5 million a year. So, unless we're, and I appreciate what, you know, I mean, they did give us a free service, you know, I mean, Troy will tell you that the county was trying to pay for it, and they're like, oh no, you got this covered. And so okay, well, we'll be happy to accommodate you.
We'll find somewhere else.
Well,
Oh, I see.
sure. Sorry,
No, I'm sorry. He said pre-Norton.
well, I mean, this was 2000.
Please know, I would love for that to be on record, that obviously the discussion of some additional contribution from the county certainly came prior to a partnership with Norton's. Obviously, it is a non-revenue producing department that has cost the organization a lot of money. So I certainly would not want the public to think that this is all being driven now because they're not a small town hospital. And
Oh, yeah,
that's
yeah.
certainly
I mean, I think you're right. I mean, it's worth on another similar but related topic, an interlocal agreement started with that. And this gives us some time to do that. So we've said we'll do 2023, but in the future, get other entities
To share the cost.
to share the partner. I mean, not that, I mean, obviously the public safety tax that goes to these other ones is not a huge amount, but
It can make a difference.
sure, I mean, it's, buy-in is nice.
Okay. We've heard the council's motion and approval. So I guess we need to follow suit.
Sure, so I make a motion, we can't do this one though, because this has got 500,000 for the year, so we'll have to get it
We could make that 250,
right. So, but I mean, we can,
but I mean,
sure, if we
do the motion.
move forward with the first amendment to the ambulance services agreement, so we'll pay 2023, 250,000. And for the following 2024, 2025, 500,000 per year with a 3-year contract.
Okay,
I second.
have a motion and a second on the Norton King's Daughters Health Incorporated agreement. So all those in favor signify by aye. Motion carries.
Dang, it's all in agreement.
Do we need the last motion? Move to adjourn?
I second that.
All those in favor signify by aye. Thanks, everybody.
Thanks.